Thank you, Madam President. Thank you, Ms. Executive Director. Honorable Lieutenant Colonel Jeffrey Bostic, MP, Minister of Health and Wellness, President of the BEC, Ms. Yvonne Hall, Vice President, Ms. Diana Douglas, and other members of the board, and as well, Ms. Sheena Mears, Executive Director. A special welcome to you and thank you for the opportunity here. Of course, our panelists, Dr. Justin Ram, International Economist, Ms. Christina Turton, Attorney at Law. We just mentioned the Lieutenant Colonel Jeffrey Bostic, Minister. So I'm extremely excited to be a part of this because this discussion is ripe and it is necessary at a time when Barbados is grappling like many other countries. So one of the things we are looking to discuss, or a few of the things we're looking to discuss, are to address the issues of building resilience in our economy. We're going to also look at the experiences of other countries to see how we can learn from some of those opportunities. And we will focus on the role of vaccines in the economic recovery and where other employment-related issues will fall into play. As the BEC is hosting this, of course, we will deal with matters relating to employment opportunities. And hopefully, as we wrap up, we will have some short discussion on what is the vision for post-pandemic Barbados. We have to make sure that we look forward to what we will be doing, what are some of those areas that we need to tweak to enhance our service delivery, and not only just service delivery, but to deal with persons. As we know, we've had such a large fallout in the economic space, particularly as it relates to employment. What are the hopes and where do we see Barbados going? And we will look at a few of the sectors as well that have been impacted. And I want to, at this point, hope that if the discussion ends with the vision and in a post-pandemic era, we would also be looking at where the minimized impact of COVID has been gone. So we will not be dealing with the COVID that we have now. We will not be dealing with the conversation I had this morning with the Chief Medical Officer. We will not be dealing with those things because we will be in a better place. So I welcome you to the discussion. I'm going to give the persons in the audience a little chance to hear who are our panelists, because of course we want to know. We have three very distinguished persons and they will of course want to know a bit of your history, what you have done, etc. I'm going to start with the minister, of course. Having held several senior positions in the Barbados Defence Force, he was also commanding officer of the Barbados Regiment. There was also a 2-year tour of duty with the Regional Security System and service. He served as the aide-de-camp of the late Governor General Sir Hugh Springer. His lengthy record of service to Barbados has included being its first defense attaché to the USA, while being an alternate representative to the OAS, the Organization of American States. Add to this his service to the Barbados Chief of Delegation at the International Military Sports Council and acting Chief of Delegation on the Inter-American Defense Board. Minister Jeffrey also has a professional military career which has seen him graduating from several military institutions, including the prestigious Royal Military Academy Sandhurst, and that's in the UK, the British Army School of Infantry, the US Army School of Americas in Panama, Center for Hemispheric Defense Studies, Lester Pearson Peacekeeping Center in Canada, and the Inter-American Defense College. Jeffrey was elected to the Barbados House of Assembly, as we know, in the 2013 general election, and we know that would have been prior to this last sojourn in 2018, and he retained his seat in May 24, 2018, and we know ever since then we have known him as the Minister of Health and Wellness in the Motley administration. But what are those buzzwords? No retreat, no surrender. Minister, I thank you for joining us. I'll also introduce Dr. Justin Ram. Dr. Justin Ram is an international economist over 25 years, and I have a lot of respect for you. As I thought I was a budding economist, but I changed pace. But yes, Dr. Justin Ram he has a lot of experience in the field, in practice, in research, development, and management. And I can add in resilience economics, but his specializations are in that particular same field: resilience economics, fiscal and debt analysis, energy economics, environmental and natural resource economics, implementation, social and labor economics. That's what you call a guru economist, Dr. Justin Grant. While in development banking, Justin was responsible for supporting many Caribbean countries, even our own, with policy reforms, which led to the appraisal and disbursement of over $400 million in finance, and that is US, if you please. He was previously director of the economics department at the Caribbean Development Bank and a member of the bank's management team. He is co-founder of the Caribbean Blue Economy Conference and the Caribbean Leadership and Transformation Forum. Justin has a diploma in executive management from Stanford University and a PhD from the London School of Economics and Political Science. He also holds a MSc in economics from the University College London, a BSc in economics from the University of the West Indies, and a postgraduate certificate in sustainable environmental management from the University of California, Berkeley. I bow my hat to you, Mr. Dr. Justin Ram. Christina Turton, I remember you as the president of the Bar Association, attorney at law and principal founder of KCT Chambers. Kristen practices in a number of areas, including criminal law, personal injury, employment law, contract enforcement, debt collection, and civil litigation. During her career, she has been driven by a pure and unadulterated love of the law, a deep desire to stamp out injustice, and a need to ensure that persons secure that which they are entitled. This has led her to represent clients' interests successfully and without fear or favor in the Magistrate Court, High Court, Court of Appeal, and even in the Caribbean Court of Justice. Kristen has been active as the chairman of the Severance Payment Tribunal, vice president of the Barbados Bar Association, tutor in the Faculty of Law at the University of West Indies, an international member of the Association of Personal Injury Lawyers, and that's in England, and even a competitor in the sport of weightlifting for Barbados at the Central American and Caribbean Games and the Commonwealth. Okay, so you're not only just a lawyer, you have a little bit of broad. Very good, very good. So I want to, of course, let the audience know that we have persons here who have good experience, who can speak to these issues. And we just mentioned just a little bit earlier, we're talking about experiences, we're talking about vaccine, we're talking about employment, how it's going to impact, and then post-Barbados, post-pandemic era. So the first question is surrounding the concept of public health and economics. And we know we're talking about the nexus here. And these two have traditionally been seen as one over here and one over there. You deal with health and then you deal with the economy. And that has been, that's how we not necessarily silo, but we always conceptualize things based on what the specialty is. COVID-19 has brought a different a different presentation to us. We've now had to see the interdependency of these two, and country evidence from across the world has shown that without adequate public health interventions and controlling economic growth, this would impede the case where the pandemic has decimated a number of countries, and we've seen this as well. So the catchphrase now is that countries and businesses must build back better. So that's the focus for this part of the discussion. We're going to have 4 short discussions, and one of them, this particular one, is dealing with how do we build back better. So the question that I'm going to pose to the panelists, given this reality, can you share some considerations for economic development and how to build back better, recognizing the interdependency between health and economics, and how would we build back better in the future? Anyone can take it first. And remember, you have to mute your mic, those persons who are not speaking, and the ones who are speaking, please open your mic.
We give way to the economists at this stage. Oh.
Oh, well, okay. Can you hear me okay? Yes, is that okay?
Yeah.
So, well, thank you, Minister. I certainly was giving way to you first, and then, of course, to Ms. Turton. Mm-hmm. Well, I think now, as it relates to this particular question, we've been hearing the phrase "build back better" for a number of years, and it first came out, I think, after the 2017 hurricanes, Maria, and which was certainly destroyed a number of Caribbean countries at the time and led to great loss of life and great loss of of assets. But I think now, Lisa, we have to move the dialogue to something else, because we don't necessarily want to build back and definitely just build back better. I think we need to build forward. That is something that I'm hearing now. And what does that mean? It means that there needs to be an acknowledgement that we are vulnerable. I think the first point of call is that we need to acknowledge that we are vulnerable. We already live in a very unique neighborhood with respect to natural disasters. But now, of course, COVID-19 has come upon us, and it has shown that we are even now vulnerable to a disease or a virus that has taken hold in the world many, many thousands of miles away from us. And so it shows how interconnected we are. And certainly for the Barbados economy, which is so dependent on tourism, we know that we now need to manage much more carefully. So I would say certainly, Lisa, in terms of building forward, is that acknowledgement of our vulnerability. And so what do we need to do to build a resilient economy? One of the good lessons coming out of this, and certainly the Barbados government must be commended for, and it's quite fortunate, is that we went into the this period of the pandemic with fairly good foreign exchange reserves. So we didn't have to panic about whether or not we were going to be able to import. And so that, I think, is the first point of call. We need to have good financial buffers in place. And so besides foreign exchange reserves, I think we also need to ensure that our governments, our households, our firms have sufficient financial buffers to take them over any sort of challenges that they might experience in the future. You need to have a buffer that can take you over, let's say, 3 to 6 months minimum. I think that has to be one of the first things that we do. Another thing that I think we have to do here, and I'm going to wrap up now, is that how do we ensure that our financial and capital markets are nimble enough to allow us to build forward? Because right now, as you know, we're going to require some resources in order to build forward our economy, not only to be resilient to the virus, but to be resilient to the natural environment, the changes in the natural environment around us, the climate change. We need our financial markets to be much more nimble to allow the type of financing that is required. And so I think, Lisa, that then points to the fact that we need to ensure that our business environment is conducive for our private sector to flourish. And so I would say for the future building forward, it must be something where we look at the private sector leading the growth and government, of course, being the facilitator of that growth. I'll just leave it there and hand it over to Minister Bostic and Ms. Turton.
Thank you. I have one rebuttal, but I'll wait.
Yeah, thank you very much. I do agree with you in relation to the vulnerabilities that have been revealed as a result of this pandemic, some serious vulnerabilities. But I want to compliment the team that came up with the topic for discussion, which is the health and economic nexus in a post-pandemic era, because this really is a very, very critical component. This is something that we've been grappling with for the last few years in health. And I must tell you that I spent several weeks and long days and hours trying to get my own team from health to understand the importance of the continuation of economic activity. Because if you look at this thing from a public health perspective, then you will get yourself into some other types of trouble. And this was the first thing that had to be done to convince the team that whatever we do, we have to ensure that economic activity can take place, because we in health, for one, depend significantly on the generation of revenue to be able to do the things that we do in health. And that was quite clear throughout this pandemic and from very early, because of the large amounts of money that we had to obtain from the Ministry of Finance to be able to do the things that we wanted to do. So yes, that is a real situation. And the other thing that what I would state here too is the need for us to build back better. And this pandemic has taught all of us that there need to be a balance not only a nexus, but a balance between economic development and public health matters. And throughout the pandemic, for example, that balance, it doesn't mean that it is stable. At some points in time, we had to give way to economic development, to tourism and so on, because once we were able to at least contain and control what was happening on the ground public health wise, then we recognized the need for opening up or allowing the economy to open up. So that was a very, very important thing for us. But what it also taught us is that going forward, this whole nexus, and this nexus has been in existence for a while, we recognize it especially in relation to the burden of non-communicable diseases, not only on the persons who suffer, but on the treasury, the amount of money that is required to be able to deal with NCDs in this country. And this is a problem. Honestly, it's a problem. The amount of money that is required, that is money that is being taken away from economic development in other areas. And then business places may not have recognized it, but I know Sir Trevor Hassel has been speaking about this for a while, and also Professor Theodore from the Health Economics Unit at St. Augustine, that the loss of productivity due to the high NCD burden is placing a significant stress on the ability of the economy to really click on all cylinders. And so that is something that is there. Regrettably, I don't think we've articulated it enough, documented it enough, or even embraced it enough to recognize exactly how important it is. But here we are during this pandemic, and we are seeing it very, very clearly. The Director General of the WHO made a statement at the beginning of the pandemic that no one was safe until everyone is safe. And that really is, to me, the key for any sort of building back. I think that building back has to have as one of the critical components, universal access to healthcare, which is something that I think we've been relatively good at, but we still have a ways to go. But what the experience has shown internationally is that countries where there is no universal access to healthcare, especially in regions that do not have access to public health facilities, those countries are the ones that are being significantly impacted even now. And that is where it is spreading faster because you don't have that critical infrastructure. So the key to offer few, the key to building back better for me has to do with striking a balance between public health and public health measures and the economy. And this is why the Prime Minister would have been saying all along that we have to press gas or accelerate when there's a need to accelerate, and press brakes when there's a need to press brakes. And what basically that is saying is that when things are good from the public health perspective, we have to allow and we have to take some risks and manage those risks for economic activity to take place. When things start to spike, and we've had some spikes from time to time, that is when we have to rein back in things. And so that balance has to take us through this pandemic, because we don't know when it is going to end. And I believe that this should be one of the legacies of the pandemic in building back better, so that we can now face a situation where these things become second nature to us. And finally, building back, the impact of climate change has taught us that we have to build climate resilient facilities. And I believe that this has to be the situation with the pandemic. We found ourselves in a situation where we had to do a lot of reconfiguration of polyclinics in order to be able to deal with the pandemic. So some aspects of normal healthcare suffered as a result because you didn't have the space. And we had to close 2 outpatient clinics in the rural part of Barbados that were vitally important. And so we've now had to refurbish those facilities, expand the facilities to be able to do those things. And I think building back, that is how we have to look at it going down the road. And those would be my opening remarks at this time.
Hi, Mr. If you want to respond to that question about building back better?
Briefly, because I suppose it's something that officials dealing with health and dealing with the economy would be more au fait with. But we can't forget that everything we do is underpinned by the law. The law tells us what we can do. The law tells us what we cannot do. And I must agree with Dr. Ram in terms of his proposal for us to build forward. I believe that in reality, what we need to build is something completely different from what we had before. And when we build that, it will be better than what we had before. And the reason why it will be better is because, well, it could really only be better if we have regard to the vulnerabilities that Dr. Ram was mentioning. We have to identify what are the vulnerabilities that were highlighted by this crisis. What were the problems that we observed and we experienced? How did they affect healthcare and the economy? And speaking as an attorney who acts on behalf of employers, speaking as someone who is an employer myself, and knowing the challenges that many employers have faced and businesses have faced, it's important that in looking at those vulnerabilities, we consider what laws or regulations or guides could have been in place to address these issues. What can we now implement to make sure that should an issue like this arise again, we can address it? Presently, much of the advice that I provide to people is based on laws that never contemplated a pandemic. So it's a matter of adapting what we have to address when you have a highly infectious disease which prevents people from working either because they are ill or because in this particular instance, there were, for example, measures implemented by the government which restricted persons from being able to go to work. What we need now are laws that consider what would have happened here and that can now provide employers with guidance and provide employees with guidance and a structure so that they know what to do if a situation like this arises again. This situation highlighted many issues, not the least of which is how is an employer to deal with issues of health and safety at work? What can they ask of their employees? Can an employer ask about a vaccination status? There's nothing in law saying that an employer can or cannot. All we can do is look at what exists. What would be good in going forward is to have something that says, this is the policy or this is the law that applies to issues of vaccinations, not just for COVID-19, but any disease or any type of infectious disease which could affect the operation of a business or the ability of an employee to perform their functions. It's important for us to look at these things, not just as vulnerabilities, but ask ourselves, what are the opportunities that we can now take advantage of as a result of what has arisen? So now you don't just have employers who are sitting and suffering because they're unable to open their business. You have employers who have adapted their businesses and they've been forced to do that because of this situation. What we need is a regulatory framework, as I said, in the form of laws, regulations, guides, perhaps from the government, that would be able to support that adaptation. So the move to the use of technology, the move to remote work, what impact can that have on the employer-employee relationship and how the law should underpin that? Those are the types of questions that we need to ask, not just to solve problems, but to take advantage of the opportunities which have arisen because we now know that we can perform services in this way, or we now know we can provide goods in this way. So that would be, those are the considerations that I would say should be applied, because once employers are certain, once businesses are certain about what they can do, once the law exists to underpin the progress to the next step, then there will be high economic performance and productivity, which are all linked together.
So those were some excellent responses. We had the whole point of building forward, making sure that the financial markets are nimble. Minister talked a little bit about the balance, striking that balance. I wanted to just make one comment about the private sector and the role that the private sector played even in response to the building. It is not always the government to do the building, as you kind of mentioned it, Dr. Ram, you said that the private sector should be the lead and government would be the facilitator. But in a scenario like COVID-19, we saw there was far more lead taken by the government, in our instance in Barbados. What say you as it relates to private sector leading in a scenario where government determines what timing persons can go to work, and the other elements that were mentioned by Ms. Turton, even in terms of the legislation that binds both the private sector and government workers as well? Just a quick response, and then we're going to go to the second round.
Thanks, Lisa. And I think that the answer to that comes out from what Ms. Turton was saying there, whereby we need to have new rules and regulations, new laws that are cognizant of our new reality. I think once we have that, then the private sector can know with some certainty, because that's what the law does. The law gives you some idea of, if this happens, then this is what is likely to happen, and then this is my role in it. And so I think that is the way that we need to consider going. Now, the pandemic, of course, is a unique situation. In a situation like this, you of course have to have the state taking the lead in this, because there's no one in private sector who can say to anyone else, well, you should do this or that. Is the role of the state is paramount there. And so one thing we have learned as well here is that we need to understand as well, what is the role of the state and how far can the state be expected to go? And we need to ensure that there are some checks and balances there to ensure that the state does not overstep its boundaries as well. So I think, to go back to the point, we need new rules and regulations, new laws that satisfy what it is we need to do for the future so that we can deal with any eventuality going forward. But those new rules and laws must equally apply to both the private sector and, I think, to the government as well, so that we as individuals, as residents, as citizens, are clear in our minds as to what the roles of each of those persons or firms or governments are expected to do in any eventuality.
Thank you. I'm hearing that I'm not being heard clearly, or that was only Mr. Moonsey.
I actually had to turn up the volume I had to turn up my volume, hoping that I would hear you better, but I am now.
Okay, so I'm going to address that when the first panelist responds to my question, but I'm going to speak now. And that is, this is now the discussion is around the vaccine. We know that there's currently no obligation on the part of a person to receive a vaccine. And some people are very skeptical at this point still about. I had a robust discussion only yesterday. There's some people who say based on the responses from CDC and the World Health, you're still going to get the COVID-19, so why take a vaccine, or why are you forcing me, and a whole host of other questions. And then we have in the chat here a query about, are we seeing, as we are seeing the recent scientific guidance from CDC restrictions, they can be reduced for those who are fully vaccinated. And the question is, can a business, just quickly, it says to allow our businesses to open fully, can employers ask staff if they have been fully vaccinated? And we just heard from Ms. Turton that there's no legislation right now. That's not within any particular legislation, so the answer would be no. And if a large percentage of the employers have been vaccinated and the staff are aware of this, it will reduce the hesitation of staff to return to the office. As we are seeing the recent scientific guidance. And then one other question here in the chat, can employers require staff to come back into the office? And what can an employer do if the employee refuses? And does it matter if the employee is fully vaccinated or not? And we can incorporate those responses in this other segment of the discussion. And this other segment of the discussion deals with, from the start of the pandemic, there was a race for a vaccine, basically, and we've seen what has transpired. Right now, Barbados has I had a number of vaccines here, the Oxford, AstraZeneca, there's Pfizer, there's Moderna, there's Johnson & Johnson. Barbados currently has the Oxford, AstraZeneca, and I understand from the COVAX, we are yet to get another type. Minister, of course, you can speak to that, but with the vaccine now present in Barbados, we don't have enough for all and sundry, but we have enough, which I understand can reach to herd immunity. So the question on the table then is, knowing that it is not mandatory, how do you recommend businesses and employers to respond to situations where potential customers and co-workers want to know about the vaccination status of employees with whom they will interact? And that's the type of question kind of related to the one in the chat. So I'm going to open that floor. Everyone doesn't necessarily have to respond, but at least, of course, we can hear from you, Minister, and any other one of the panelists before we go to round 3. Thank you. I hope you heard that.
Yes, very clearly indeed. No, thank you for this. This is a very interesting question. And let me say and agree with Mr. Ram, Dr. Ram, that this is not legislated in Barbados in terms of vaccines. Immunizations have never ever been legislated or mandatory in Barbados. And that is certainly not the case at this point in time. Now, it does not mean that it could not happen if there's a requirement for the public good and for public health. But at this point in time, the answer is no, it is not mandatory. There are other things that we need to be able to do. But I also want to add that there's no scientific evidence to suggest that mandatory vaccinations actually, or vaccine policies actually result in an increase in the number of persons taking vaccines. There's just no evidence at all to suggest or to support that. But I'm going to start from the point of view and business persons. I'm saying to you, do not put your eggs in the basket of vaccines alone or testing alone. I'll tell you what is going to save you and your business. Adhering to those protocols that we've been speaking about all the time. That is the foundation. That's the bedrock. Because,
Minister, could I ask you to kindly repeat that again clearly?
Yeah.
Because you're making a pretty strong statement.
yes.
I want it to be very clear.
Yeah, I'm saying do not rely on the vaccine alone or even on testing alone. The foundation for keeping your business and your workers safe really is the adherence to the universally accepted protocols. And those are obviously hand sanitization. You know them better than I know, I think, because you've been hearing us speaking to them regularly. As I say to people, the protocols protect everyone in the building, in your facility, those who are visitors, those who are workers. Testing and vaccines will provide some sort of protection, that is true. But I'm suggesting to you that if you really adhere to the protocols, you will find that your businesses will be safe places for persons to work and to patronize. And that has been the experience during this pandemic. There have been several businesses that have been impacted in Barbados by COVID-19. Some big business owners in the initial stages, especially back in January, sent the entire place for testing. And that is when we had that big surge in testing and caused us some significant issues. But it was not a public health directed decision or operation because we do not necessarily test every single person. So the vaccines, yes, the vaccine really will now give us a more sustainable future going forward, especially if we are going to have this virus with us for a long period of time. The vaccine is very, very important. But what we are saying is that we have to use all other means of communication, education, trying to satisfy people and quell people's fears about the vaccines. Those are the things that we have to work on a lot harder. And I'll tell you, at the beginning of the process, the uptake was not good. And actually a little survey was carried out and the figures were not looking good for people who wanted to take the vaccine. But when those vaccines arrived, and after the public communications campaign, which must be ongoing and even enhanced, we then started to see a significant increase in the number of persons taking the vaccine. If we go back to testing, and I know that's going to come up later, the same thing happened with testing. Getting people to test is not an easy thing. It is not legally required in a sense, although there is room for discussion there, depending on if a person is a primary contact. But you know, when we had the surge in January, you could get, the whole of Barbados wanted to be tested. So that once there's fear and anxiety, you're likely to get people coming forward. Regrettably, we are at a period now where we have things, knock on wood, under control. That could change very quickly, all of us know that. And so people may not necessarily see the need for taking the vaccine at this point in time. But I'm saying that it's still important. because once we have fully vaccinated persons, once we reach herd immunity, and we're not there, Lisa, we don't have enough vaccines available yet to be able to do that, but we are hoping to get this large shipment shortly, and it's only AstraZeneca that we have available to us at this point in time. But those vaccines will play a significant role, especially in an era where we have to live with COVID. The vaccines become very, very important. So there was a question that you wanted me to answer in relation to the vaccine. I don't recall which one it is.
No. The question is answered because the legislation is not there for.
Yeah, no, the legislation. No, the legislation is not there. And to be honest with you, if you go back to the HIV pandemic several years ago and what has transpired since then, there was a time when everybody wanted to know the state, people didn't want to work with people and all of that, but we were able to get that dealt with through proper communication, proper education, and that's the way to go in this pandemic.
And before we get a response, I see the president has a comment here in terms of the Discrimination and Employment Act. An employer shall not require a person to answer questions in relation to or undergo a test for a medical condition as a precondition to entering into a contract of employment or as a condition for the continuance of employment. You wanted to respond, Dr. Ram, or that was Ms. Turton? Both of you have your mics off, so I assumed you wanted to respond.
Well, yes, if Dr. Ram isn't going to respond first, I can address some of these issues. It is true that the vaccine is not mandatory and there's no legislation mandating anyone to take the vaccine. There also is no legislation that empowers an employer to mandate that an employee take a vaccine or take a test. However, we do have the provision that was pointed to by Ms. Hall in the Prevention of Discrimination and the Employment Prevention of Discrimination Act, in which it indicated that an employer shall not require a person to answer questions in relation to or undergo a test for a medical condition as a precondition of being employed with that particular business. But there is an exception to that. The exception is where it is a genuine occupational qualification, which would mean something which is an inherent requirement of the work that the person is to perform. And so what I have gathered from looking at all of the legislation, there are some jobs that will require, for example, someone to travel abroad. And to the extent that we know that there are many jurisdictions that you cannot travel to unless you have, for example, a vaccine for yellow fever. If my job is to travel to one of those jurisdictions and I have not been vaccinated against yellow fever, then I can't do my job. And if I can't do my job, then the employer either cannot continue to employ me or the employer must employ me in a different capacity. So adapting that to this situation, an employer would be able, for those purposes, to require employees to confirm their vaccination status, if that is something that a third party that they do business with, or in order for them to actually perform their job functions, that person requires it. So that's one example. But the more important point is that it's a health and safety question. So it's not just whether you have this third party that's requiring that information, or whether the person can continue to be employed if they don't provide you with information that they have been vaccinated, etc. The real question is, can I ask my employee information about whether they've been vaccinated or whether they would be willing to do a test for COVID-19 for the purposes of ensuring that the work environment that they operate in is safe? And that's a different question. An employer has an obligation to make sure that the work environment is safe and to take all appropriate steps to do so. An employee also has an obligation under the Safety and Health at Work Act to make sure that they comply with the requests and with the policies of an employer, which exists for the purposes of keeping that employee and all other employees safe. So, given, for example, recent guidance from the CDC, there's a suggestion that if you have two people who are fully vaccinated in the same space, that it is safe enough for them to not wear masks. That it is safe, that they are less likely to contract or transmit the virus, either to other employees or to customers. Therefore, an employer is really entitled to ask an employee, of course, it's in the absence of specific legislation, but based on the legislation that exists, the reasonable interpretation is that an employer is entitled to ask an employee about their vaccination status so that they can properly organize the business and to structure their policies and procedures for safety and health at work. So if you have 2 employees, for example, and both of them are vaccinated, you may want to position them someplace to do a function where social distancing isn't possible because of the nature of their job function, or where regular barrier methods such as use of a mask or a shield or a plexiglass, that is not something which could reasonably be done. That in and of itself is a good reason to ask your employee. Ultimately, it comes down to the particular job that the employee is doing, the particular nature of the business that the employer has, to determine whether, well, not just whether they can ask that question, but what they do with that information. What employers need to be mindful of, though, is that that information is entirely confidential unless the employee consents. So while I am entitled as an employer to ask that question so I can organize my business, I'm not entitled to reveal that information to my clients. I'm not entitled to reveal that information to other employees unless each individual employee consents to me doing so. So it's important for employers really to engage with their employees. I know many people who have no problem saying that they've been vaccinated. In fact, they want everybody to know that they've been vaccinated. So it's a matter of having a conversation with your employees and saying to them, well, 1, are you vaccinated? And 2, do you have a difficulty with me revealing this information? Right? Either to other members of staff or to potential customers and clients. I hope that in what I have said, that I have answered more or less the queries that were made. But Lisa, if I did not address any particular query that was in the chat, just remind me and I can address it now.
Yes, I'm coming back to you again because what I've gathered from your surmise is that it is not cut and dry. It is dependent on the workplace. And therefore it would be specific to each workplace. It is not, you can't just say, no, you can't ask me any questions and I'm not going to get vaccinated. And that leads us into round 3, but we're not getting to round 3 as yet because that's a specific point in terms of refusal. I'm dealing specifically with the workplace and the vaccinations. Am I clear that as an employer, I can request a vaccination from an employee based on the health and safety of the organization and because of the proximity of that employee sitting to another, or to be tested. So let me just give you an example of, I saw one in the chat earlier where the person said that food handler certificates are required. You need to go and go to the polyclinic and get yourself sorted in order for you to have this job as a restaurant worker. And if you don't want the job, then you don't have it. In this instance, with the special circumstance of we're in a pandemic and this is a highly infectious disease, an employee may feel as though if you come to my organization, if you come to my organization and you're not covered, because we call it a cover, because it is not a guaranteed, it is a cover, and you don't have the vaccination. I heard you, Minister Bostic, about this not being the end all and be all. There's some persons that can still contract, etc. We know the science, but the question is, if I feel as though my clients will be safer and my other employees will be safer if all persons are vaccinated, how do I respond as an employer with my employees in trying to get them to follow the script in terms of health and safety for my organization?
Okay. That's really multiple issues. The very first one I want to address is that presently there is nothing authorizing an employer to be able to mandate that an employee be vaccinated. Right. And certainly not simply for the purposes of, well, I have to sit in close proximity to this person, so in order to perform my job functions, so you must be vaccinated. There are other things which an employer can do with his workspace and how he organizes his business, which can keep employees within that type of context safe. And because of that, it would not be reasonable for an employer to impose a requirement for someone to be mandated, because there are other things they can do. However, we have to remember that, as I said, there are other things an employer can do. The only time that it can be mandatory is if it really is something which is required, particularly by a third party, and not just like a regular client, but as I said, something where you have an official organization that is saying that you cannot do business with me unless you have this, the same way that there's a requirement for the food handler certificate. Now, if government required that for specific things, for example, things like nursing or childcare, then of course the employer could mandate that, right? So that is something that we really have to look at. The next thing is that in some other jurisdictions, what they have actually done is to create legislation or regulations which authorize employers to mandate the taking of vaccines for certain types of jobs or subject to certain types of exceptions. That is something that we may want to consider going forward, but it, as I said, doesn't exist now. But if we were to do that, then it would put employers in a better position to know how to address these types of issues. The last thing I want to mention is that because the vaccine is not readily available at this point in time, everyone cannot get it. Even if everyone wanted it, they can't get it. It would not be reasonable for any employer to mandate anyone to get it, because it still has to be something that they can comply with. What I recommend is that employers not mandate employees to get it, but that employers have a vaccination policy which provides employees with guidance as to how they communicate their status to the employer, and they provide reputable sources at which the employee can get information about the vaccine, and they basically encourage their employees to consider getting it. And importantly, to go to a doctor first to confirm that they don't fall into certain categories which could put them at a health risk if they were to take the vaccine. Certain categories that have already been identified. Obviously, there are new vaccines and there might be things that we're not aware of, but that is something which I would recommend to employers, because we also don't want a case where I mandate an employee to get a vaccine and then they have an adverse reaction and then they sue the employer. It has to be subject to these particular things so that the employee can be safe, but the employer can be protected as well.
That's good. That's a good response. There's a little jolt here where because of the setup in Barbados, very different from other countries, particularly North American and others, where you get your vaccination, where you get your test, and you could be COVID positive and you're sent back home, obviously, because those entities can't withstand, putting everybody in. Like how we have persons at Harrison Point. And a scenario like that, an employee doesn't have an obligation to inform his or her employer that they have COVID-19. And that's another scenario where when they get the result, they don't have any choice, they don't have an obligation to share. But that's another something. I want to move. Do we have any other questions? Any other comments on that? Minister, I see you smiling a lot. If you want to respond, then.
I'm smiling because I found it interesting what Mr. Turton was speaking to, and then your question or what you were asking in relation to testing, I found interesting, but no, I won't comment at this point in time.
Okay. I do have two questions though. I think it's on the same point. If the employer, this is from Ms. Abrams, but before I go to her, there was another one. I don't want to miss any of our queries. And this will be here. Yes, Ms. Reed. Our government and the union leaders need to be more proactive in encouraging the public to be vaccinated. Public comments by labor leaders seem more interested in advising employers not to try to force people to be vaccinated rather than educating the public, including their membership of the benefits of being vaccinated. For example, what is the vaccine ratio of health workers? What is the ratio of airport and seaport workers vaccinated? What is the ratio of teachers vaccinated? Has it exceeded 50% in any of these areas? And if not, why not? These are the people that should be leading by example. The business operators are doing as much as can be expected. The issue is outside of business hours, people relax and they let down their guard and abandon the protocols, and vaccinations will reduce the risk to all. Interesting that those are not questions, because I'm sure that that data may not be so readily available for this forum, but it will be available by those, both the two leaders of the vaccination. I wouldn't want to stop the minister from responding, but I'm sure we can get that information. And then I'll go to, if the employee, and please, panelists, if any of you want to respond to these comments I'm reading to you, feel free.
Yes, there's one I would like to, please.
Yes.
And I agree with the comment from the person in terms of
That's Ms. Ann Reed.
Huh?
That's Ms. Ann Reed from
yes, in terms of increasing public awareness and education and all, that is absolutely true. And I was saying that earlier. The challenge though that we have, and where you're not going to get necessarily all the statistics that you may be looking for, is because we have not really been able to get the vaccines delivered to us when they were supposed to be delivered. That has put us in a very kind of a precarious position, and we've constantly had to be changing the dynamics to suit the availability of vaccines, and to get it spread across the board. Sometimes we've had to reduce the numbers of persons who we were going to vaccinate in the particular sectors because of the unavailability of the large number of vaccines. So that is one of the issues that we have. And then it is very difficult to try to do an all-out campaign nationally, public awareness and so forth, to try to get people to take the vaccine if you don't have the vaccines. And this happened to us early on, and people got very frustrated because people turned up at polyclinics and so on, and we just did not have the supply. So that is an issue.
Okay, I have one other question before we go on to round 3, and it says, if the employee refuses to disclose the challenge falls to the employer to assume that the employee has not. I'm not clear what you mean there, Ms. Abrams, with EE, and assign them accordingly. This may pose scheduling or roster challenges unnecessarily. Any thoughts or on recourse for employers? E is employee. Yes, thank you.
I would only indicate that employees are obligated to comply with the requirements imposed on them by employers for the purposes of health and safety. Okay. An inquiry into whether they're vaccinated is something with which they have to answer once the purpose of it is for the employer to be able to provide a safer work environment for them and other employees. If they fail to do so, they're in breach of the legislation. There is actually a penalty, a criminal penalty that can be imposed on them. But more so for the purposes of employers, it could fall into the category of insubordination, because it's a reasonable request that the employer is making in order for the employee, for the business to function and for the employee to carry out their functions effectively. So the employer may wish to consider disciplinary proceedings in those circumstances, bearing in mind every case has to be looked at based on its own specific facts. But a simple refusal to disclose, it must be pointed out to them that they really have a responsibility to disclose that information, and they should be encouraged, or it should be made clear to the employee how that information is going to be managed, that it is confidential, that they cannot disclose it and it will not be disclosed without their consent, and those types of things.
And I'm seeing here that there are some questions in our question and answer segment. I would want to turn quickly to round 3, and then let's see if we have time for those questions. In recent weeks, there have been reports of persons refusing to be tested, and we kind of covered some of this, so we can go from here to most of those questions. They've refused to be tested for COVID-19 after contact tracing identified them as being potentially exposed. Employers are required to provide a safe place of work and safe co-workers. How is this possible in a public health crisis where employees cannot be forced to undergo medical testing? And Ms. Turton, you actually captured that in your response just now about an employee being in breach and could be criminally charged if they refuse to comply from a public safety perspective. And I saw you respond as well, Minister, so I'm going to go quickly to the questions, and some of them are comments I'm seeing. So where I see a question mark, I will respond to those. Given that NCDs are placing such a strain on the economy, what measures and/or incentives can be put in place to better control NCDs? Then we have, I'll put them all together. Hi, is it possible for an employer to help facilitate their employees to get vaccinated? That answer would be yes. such as having a clinic on site or alternatively make appointments for the staff en masse and they organize transportation. And that has happened in my instance. I work for the Barbados Accreditation Council, and we've been asked, are we interested? And then a day was set, and all of our staff, those who opted to go because some of them refused, and or chose not to, I don't like the word refuse, some of them chose not to. And then in my capacity at the Barbados port, that was done for all staff as well, those who again chose to do it. So yes, that occurs. And then if you mandate vaccines, then the vaccine, and is proved to be non-effective, unlike the typhoid vaccine, what happens then? And then the last question here, as the cruise industry is resuming shortly, cruise lines have indicated in some of their protocols to indicate that all local staff working at attractions, transport, luggage operations, etc., must be vaccinated or tested each week. Kristen mentioned a third-party request and such as it relates to the working environment, and can you kindly elaborate? And I think I missed one of the other comments. They did not have questions, question marks. Okay, that was about information leaflets for the COVID vaccine. And then, given Barbados's reliance on tourism, can we try to change this? I understand that Barbados relies on, okay, let me start from the beginning. I understand that Barbados relies on tourism. However, can we try to change this? Find alternative means of income. I like that, that's an economic comment. I like the hotels are offering staycations to locals. That is a good move. I like that cruise ships are homing here as well, but we need some other form of tourism. Workaway is a good idea. How about ecotourism? I believe we need to focus on more on feeding Barbadians for local production and avoid imports. Well, I agree with you wholeheartedly. Foreign exchange, foreign exchange, foreign exchange. But I would like the panelists to kindly respond to those range of questions that we would have heard from the question and answer tab. Right, thank you for sharing, audience.
Yeah, I'll tackle the one on NCDs quickly. Fair question. This has been an issue not only for Barbados, well, globally and with the Caribbean in particular too, for several years. And our situation is nowhere where we want it to be. So we've started to do a number of things to be able to deal with this particular problem. For example, we are trying desperately to enhance the delivery of services at the community level, especially Ncd related services for the treatment of hypertension and so on, and diabetes in particular. And we believe that once we've been able to get that going in the right direction, that we should see fewer numbers going to QEH and also repeating or returning to the Queen Elizabeth Hospital. The game changer at this point in time, though, is the launch of the initiative that we did at the QEH, where we now have a team of persons, about 35 or 40 at the moment, but the numbers will increase. They are going into communities and dealing with a number of the most serious cases as identified by the physicians at the QEH, to be able to help them to manage the Ncd. So you get a person going in and they may have, let's say, 5, 6, or 7 persons that they have to check on and report. And if there are any serious issues, they report to the 2 doctors who are responsible, so that we can deal with it at an earlier stage than having to deal with it at the hospital when things get a bit dicey. So that is another initiative. We also have an initiative. This one has not yet really come about because of COVID to some extent, but we have a grant. There's an Ncd grant which persons who suffer from NCDs will be able to qualify for, as directed by physicians, so that if you are managing your Ncd and you may need some financial assistance to be able to purchase the things that we want you to eat and not the unhealthy things, because you may not have the wherewithal. If you are managing your NCDs, you're taking medications, you're exercising and so on, and the doctor can see that you are progressing, you can continue to receive that grant. So that is one other thing that we have been able to put in place. And then the whole question of wellness, that is why the ministry was redesignated to be health and wellness, physical activity, mental wellness, all of those things contribute towards what we are trying to achieve. So we are looking at it really from the community level and in a holistic manner. And at the end of the day, there's certain indicators that we are looking for to be able to tell us if we are really making an impact. And at the end of the day, that it should be shown at the QH with reduced numbers.
Thank you so much. And there was a query there in relation to diversification. Dr. Ram, if you can respond.
Sure. Thanks, Lisa. And I guess I'll also respond as well to the whole issue around NDCs. You know, as I listen to, you know, both of my fellow panelists, I think it clearly comes down to education. More and more, we need to ensure that when our students, our young people leave our schools, that they have a full understanding of what it is to be healthy, the things that they need to be eating as well. No one should be leaving school knowing that it's okay to be drinking 2 or 3 sugary drinks every day. These things have to stop, because I think the pandemic has also shown us that there's a clear link between getting the virus, being obese, and your probability of dying from the virus. These things need to be clearly understood now. And I think within our education system, everyone needs to understand what is their responsibility for their own health, understanding, of course, what is the responsibility of those who provide public health as well. And of course, well, for employers should also understand what sort of incentives they could also be providing to their employees. You know, can you subsidize gym membership? Can you have some type of compensation around healthy living? You know, I'm just putting those out there. Now, let me just also turn to the whole notion around the diversification of the economy. Again, I'm going to say that is all about education. I think as well, just as I said for the health of the individual, there should be no one leaving school after 15, 16 years of school who does not understand the basic how our economy works here in Barbados, and certainly for small open economies. What does that mean? It's really important that we have the capacity to export goods and services, to earn foreign exchange, but also on the flip side, is it possible for us to reduce our usage of foreign exchange through import substitution? And why is that so important for the health and economics nexus that we're speaking about here? Because I'm pretty certain that if we were to go back to consuming some of the things that traditionally would have been grown in Barbados, and now that unfortunately for many of us, we don't consume many of these things, we would find that many of those things are a lot healthier than what we import. And if we're able to do that, we're able to hit this health economics nexus in a really, really good way and targeted, because now we're dealing with getting people to become healthier, but also helping the economy as well by using less foreign exchange. That foreign exchange could now be used for more types of investments that would generate income overall. Now, just to say one last thing on the diversification of the economy, this again requires, I think now, the government to become the facilitator of economic activity and to ensure that it is as easy as possible to do private sector activities in this country. If you come out of school or you come out of university and you want to be an entrepreneur, it should take you 2 hours to establish a business, for example, to register a company online. It shouldn't be costly to do that. It should be very easy for you to go online and pay taxes, for example. If I have to export a good or service, well, to export a good, that should be very, very easy to do through the port, and it should be fairly affordable. To export a service, well, it's quite easy now, but I have to ensure that I have good online connectivity. So I just really want to say it's education for both health and as well for the economy. And of course, I think we need now the government to facilitate private sector activity as much as possible. And I just reiterate that because I think that's the way we're going to build forward.
Thank you. If I have any other questions, I only one query here in relation to what is the number for entities to work on getting the vaccination, and I think, Minister, you can share that with us at some point. I also wanted to, in the last few minutes we have, just to understand, where do we go from here? What are some of those lessons learned? Where does the private sector, particularly the employers, what type of lessons they can learn, what type of positions they can take? I like the legal guidance we received as well from Ms. Turton. But just what is your vision for post-Barbados, post-pandemic era? What are your thoughts? Each panelist. And we do have a few more questions that are coming, so those are still going to come. I'm just wanting you to think of your response in the context of, based on building future or building forward, and based on building with balance, and based on building within the context of the vulnerabilities that we have, and building with the framework and the basis of legislation and policies that will guide us in another pandemic or in another type of environment that we have not planned for. Those types of responses I want to get from you as you respond. I'm going to read two other comments on the questions. And the question is, as in relation to NCDs, taking a deep dive. Can you tell us how government will take a deep dive into NCDs? The topic of NCDs continues to be dealt with on an ad hoc basis. Even although we have a commission, Ms. Eswit, we have a whole commission that has been in existence for a number of years, and a lot of work has gone in the work, particularly on that commission. And then we have the Heart and Stroke Foundation that has done a significant bit of work, even partnering with the Ministry of Health. So there has been quite a bit of work that has gone on, and I think I fully endorse that comment about education just from Dr. Ram, because we need to inform our people, and it starts, yes, in the schools, and there's a whole foundation now helping our schools with the same Heart and Stroke Foundation. It is I can't remember the name of it. It is a US-based company, and I'm sure they wouldn't want their name called, but they are the ones sponsoring that initiative right now for the children in the primary schools, really to educate them about the importance of eating properly and the importance of exercise and moving, and reducing that significant drag that NCDs is having on the economy and on families, because it is this same nexus that we talk about, health and economy. Because if you have people who cannot produce in the workplace, they can't really go to work, they have diabetes and some other issues, then they can't really contribute to their family, they can't really give up their best. And then look at the drag it is having on them going to the doctor bills, etc. So I fully endorse that point there as it relates to education. But when we talk about NCDs, a lot of work, and that's why I'm responding to you, Ms. Eswit, a lot of work has gone on. But are we as a people taking in, given the culture that we have, when we eat we must have a sweet drink, or when we have a lot of bad habits that have been handed down to us by our ancestors, and we are carrying them through, and that's why there's so much of our population that are suffering. So many people are suffering from these NCDs. But I'll continue with your comment here. The topic of NCDs continues to be dealt with on an ad hoc basis, and I do disagree with you given the work that has gone. That's why I responded the way I did. Our roads provide no infrastructure for walking or riding. Our tax policy imposes higher levels of taxes on some of the more health foods. I think you mean the more healthy foods. Yes. Where is this addressed in our education system? How are we looking at what is being sold at the school cafeterias and from vendors next to the schools? This needs to be deep and strategic. This needs a deep and strategic approach rather than managing the outcome. And I would tell you that a lot of work has gone on.
Lisa, can I have a moment?
Sure, you can respond.
Yes, thank you, Lisa, distinguished panelists. I've tried basically running programs as someone working in HR, basically with teams, and we've done a lot of talking. And I'm encouraging everyone on this discussion for us to take one step further. How do we facilitate the practice of what we've said to people that they should do? We say don't have soft drinks basically with your meal, but we make that the most easily accessible drink for students at school. So it's one thing to tell them, don't have it, but it becomes the single only choice or the widest choice that they have for some form of refreshment is a soft drink. I've tried basically, because walking is one of the easiest ways basically of managing a lot of the NCDs or road infrastructure. We don't put that into the planning part of it. And I'm saying that we need to step back now and ask, how do we facilitate the behaviors that we have tried to inculcate in the population at every single level? That talk has to be facilitated by programs and infrastructure that makes it far easier for people to walk. It is very dangerous to attempt to walk in Barbados. I've led teams, I hike with people. The sides of the roads basically provide very limited sidewalks. We read in the newspapers every single day of the significant dangers that cyclists endure basically trying to cycle. And I'm saying we have to step beyond just the talk, beyond just the slideshows that we put up, by looking at the infrastructure in terms of physical accessibility. I talked about the gymnasium in this comment to see if the gymnasium basically, which is a center for a lot of people who live in the area, who walk in that area. The lights have been turned off in that area now. 4 months, all right? So it means basically that an individual walking out there after 6:30 in the evening, it becomes dangerous. We can't have a national policy that's talking about NCDs and it is not sustained by thoughtful application as to how we support the population as it attempts to transition. The transition is going to take some time, but we have to move beyond the talk to action. Thank you for this time.
Thank you so much for sharing. And I know the minister is biting at his chance. And I'll say one thing. There are a lot of pockets of, there's some things you just don't know. And there's some things, so en masse, as a country, we're not moving. And I agree with you totally. We need to move more. And this is a call then for the Ministry of Health and Wellness. Even if there's a once a month, a walking thing that is done, every Barbadian should walk a certain amount of hours, a certain amount of meters per day, or minutes or something. That could be implemented pretty easily. But simple things as parents, a lot of us in here, we may be parents. I don't buy soft drinks. I stopped buying soft drinks 4 years ago. The choice of drink in our home is water. It is special occasions that I may buy 3-pint dairy juices and don't buy any more for the rest of the month. That's a decision I've taken because of soft drinks. More people can do that. More people can drink, and by the way, pine dairy juices are very sweet. But I don't drink them, I buy them for my son and my husband. But I want us to know that we can do our part as well. I agree with you totally. So, Minister, of course, I want you to respond.
Yes, I'll try to be quick here. First of all, I thank you, Madam Eswick, for your thoughts. And I agree with a lot of what you're saying, but also a lot of what you're saying suggests to me that we need to do a lot more in terms of getting the information out there so that people know exactly what is going on. I must tell you that the NCD campaign is a very structured campaign, as a matter of fact. Right now, there's a new NCD plan for the next 5 years, but it has to go to Parliament. But this plan includes a national cardiac plan, and a lot of that work is in progress. There's a national cancer plan. It also speaks to a national nutrition plan, and the first part of that plan has been completed, which is a school's nutrition policy. We are in the final stages with the Ministry of Education before that is documented and put out there so that we can start it from the next school year, because childhood obesity obviously is a matter that we have to address and wrestle to the ground before that translate into more serious problems going down the road. In terms of the walking and so forth, I can tell you that the Ministry of Health National Task Force on Wellness was conducting some very, very good hikes on Saturdays, some Saturdays and Sunday. The last one, we had close to 500 persons, but that was halted because of the the pandemic. And even during the pandemic, we've actually been doing 1 or 2 things on GIS so that people could still exercise at home. The new town planning policy going, I can tell you that any new development in Barbados now has to take into account exactly what you just spoke to, ma'am, which is walking tracks and so forth within the development to be able, to facilitate the things that you're saying. So I agree with you 100%. In terms of the food, that is a serious matter in relation to soft drinks. There's a matter I've had at the Ministry of Health and Wellness because they represent one of the most socio-economically challenged constituencies in the country, the city of Bridgetown. And I was saying to my own people at the ministry that if we do not provide some alternatives economically, the first thing people are going to do is go and buy the soft drinks because it's going to stretch further with the amount of people that they have to look after and so on. So I have approached and included in that NCD plan, the Ministry of Finance and Economic Affairs for them to take some taxes off of a basket of items that we want to make available and easily available to persons of healthy foods. If we don't do that, then the other thing's not going to go very far. So that I accept that. So you're right on the ball there. So you've made some interesting points, ma'am, and I will take them on board when I go back to the team. Thank you very much for sharing.
Thank you. Do we have any further comments from our panelists on the comments that would have been made in the chat, whether to do with NCDs or employment-related issues?
I will just say that I totally agree with what the minister just said and what Ms. Estwick said about the need for sort of a joined-up policy approach to this. Too often, I think policies are provided that are not well thought through, and I think what she has mentioned there makes absolute sense. I would just go one step further. So the minister mentioned that the removal of taxes on certain types of nutritious and healthy foods. I think what we also have to look at as a society is that there are certain things that give us what we call negative externalities in economics. And when that happens, we need to discourage those types of behaviors. And I think that sugary drinks and consuming too much sugar is something that we need to really discourage right now. And perhaps the government might want to consider some type of tax on sugar, for example. I know that they've done that in the United Kingdom. I mean, that, of course, I know, Minister, that a tax is always never a popular thing. But I think the time has come for us to ensure that unhealthy food is much more expensive than healthy food. And if the market isn't doing that for us, then we need to step in as policymakers and through the tax system to correct that abnormality in the market.
Thank you so much.
And,
I see you.
I just wanted to respond to some of the questions relative to employment issues. There were two particular questions that were raised previously. One has to do with the appropriateness of an incentive, which would see, for example, an employer having perhaps a pop-up vaccination near to the office and so on. And I juxtapose that against a question that was in the chat relative to having an office raffle only for persons who've been vaccinated. I think employers have to think of creative ways in order to incentivize their employees to take the vaccine if they believe that's in the best interest of their business. The on-site vaccination is reasonable. That seems to me to be something that's reasonable. But any incentives should be directly related to making it easier for the employees to, one, get information about the vaccine to determine whether it's appropriate for them, and two, to have access to it. So for example, you might want to have incentives that don't necessarily give someone a benefit over and above another employee for being vaccinated. But if you are vaccinated, I'll give you 2 days off after that don't come out of your sick days, because I know you will need time to recover. And that cannot be said to be discrimination in any way, right? So you have to be creative in how you look at it. You can say to employees, well, those who are, you can't say to someone, if you're vaccinated, you get to do a raffle. That would arguably give that person a benefit over and above someone else who is not. But you can say to employees who are vaccinated, and assuming that ultimately there are guidelines similar to what we have with the CDC that say that two persons who are fully vaccinated can operate in the same space indoors without masks. If we get to that point, then you can apply different safety and health policies, perhaps less restrictive ones for those who are vaccinated versus those who are not. And of course, that's subject to the guidance that the government will ultimately give on those issues. The second question arose relative to cruise liners and the fact that some of them are requiring that any attractions and so on have employees who are fully vaccinated in order to interact with any of their customers. Now, that makes sense because cruise liners are requiring people to be vaccinated in order to take the cruises. If I have a business and my business is dealing primarily with tourists, that really is a third party imposing a requirement on me now. And that requirement is one that I can pass on to my employees, right? Similar to what I would have mentioned before about employees that have to travel. The question is whether it is a genuine occupational requirement. And in order to answer that, the first question is interacting with tourists coming from these cruise liners, is that a necessity for the person's job? If the answer is yes, then it's not that they must be vaccinated and you must reveal that information. But the second question is, can they be redeployed, or are they willing to be redeployed to another area of the business where that isn't required? And if they're not willing, or if that's not possible, then it has become a genuine occupational qualification. And in that respect, your employee will have options. Either they will not continue to work for you, you have to organize a separation, you might have to organize a separation package, or they decide that they're going to take the vaccine and allow that information to be revealed. But each case, as I indicated, has to be looked at based on its own circumstances.
Excellent. I see your hand still up, Ms. Eswick. Was that deliberate or you forgot to take it down? At this point, I'm going to ask.
I'm sorry, I'm going to take my hand down. Thanks.
Okay. I'm going to ask the panelists to share with me some closing remarks before we hand over to have our vote of thanks. I do have a few, if you want me to start helping you. The first one is to build forward.
Thank you. I think that going forward, and my view is that this pandemic, and honestly, it has been a challenge, but this pandemic for me has exposed several vulnerabilities and inequalities in our society, in our economy, and I would even say it in our culture. And going forward, we need to be able to address these issues, and by addressing them, because some of these things are actually considered to be social determinants of health, leading to sickness and to disease. And I think going forward, we have to utilize the things that work well out of this pandemic, including for commercial enterprises. And I say that because I give you a lot of credit. Most of the places that I've gone to, I am really impressed with the protocols that are being put in place by employers. That's the truth. If not, the situation could have been far worse than it is today. And there's some that have been exceptional, in my opinion, in the way they've gone about things, and I would like to see that continue. But my major problem here is that the 1918 pandemic, I don't think that there were a lot of lessons learned or that were taken forward from that. And it seems as though every pandemic seems to catch us off guard. And this must not be the case in this one. I'm telling you that because for one, I've tasked one of the medical officers of health who's working in collaboration with the university to document Barbados's experience as a small island developing state, the impact of the pandemic, how we respond, and so that there must be some book, some document that years from now, the next generations of persons can pick up, and the next pandemic come, that they can go forward from there with that. But one of the most critical things, the supply chain, the disruption of the supply chain and getting things into Barbados was a significant problem. And even in terms of food security, the pandemic has shown us beyond a shadow of a doubt that we need to do a lot more locally so that we can satisfy our population in any form of emergency when those supply lines are no longer operational, or when we don't have access to a lot of stuff from overseas. That is something that we need to be able to deal with. So those would be my closing remarks and to thank everyone very much for your comments. A lot of good things were shared, and I will take forward some of those things to my team so that we can improve on what we are doing. Thank you.
Thanks, Minister. I'm not going to let you go yet, though, because you mentioned the disruption of the supply chain and the lesson learned there and the impact it had on food security. What then is the administration doing to ensure, not just to document and share the story later down the road, but what is the government doing to ensure that we reduce the impact of the vulnerability? Whether we have another one in 10 years, 5 years, 15 years, what can you say are two of the three mechanisms being put in place to reduce the food security exposures that we found ourselves exposed to?
Yeah, well, I can tell you that even before the pandemic was declared officially, that the government tasked the Ministry of Agriculture to produce some 6-week crops and commodities in anticipation of this particular situation. Did we do enough? I think we were kind of lucky because in the initial stages, things were going quite well, but we need to do a lot more with food security. And I believe that the Ministry of Agriculture has been tasked to do just that. So that is the first thing. The whole question of pharmaceuticals and the delivery of pharmaceuticals, we tried in the early stages to stockpile on various pharmaceuticals, and we were not successful in some cases, especially with medications for things like NCDs.
Minister, could I ask? Yes, thank you. Continue.
Sorry? Oh,
you continue.
That is something that we need to really improve on going down the line. And what I like about this pandemic, and I would like to see it going forward, is that there was a lot of collaboration and cooperation with the private sector and the public sector. And the private sector made some significant contribution. And I believe that this ought to be maintained even going forward after the pandemic, to ensure that the whole country is better prepared for dealing with anything that comes our way in the future, and especially trying to help us to deal with the very NCD issue that I spoke to earlier, because that is the one thing that is going to cause businesses to be in trouble and the country to be in trouble in the future. Because 7 of the 10 leading causes of deaths are still NCD related in spite of this pandemic. Thank you.
Really good, excellent, thank you. I'm going to ask Ms. Turton, based on the commentary in the discussion, as we talk about wrapping up, were there any, well, yes, there was clarity provided, but my question to you is, were there any issues that kept coming up within the last year that you see employers wanting to address post this pandemic year? If you may share that, and then I would ask you to share your closing remarks.
I think ultimately a proper understanding of the responsibilities of employers in a health and safety, in terms of health and safety, is something which we saw a lot of. There wasn't sufficient clarity based on the legislation because it never contemplated this. And the guidance, though it provided, for example, specific guidance for restaurants and so on, but there are many other types of businesses that had to just observe what was being done for businesses that were identified and see how they could adapt it for their own. So I think perhaps that's something that employers want, some more guidance on that. Additionally, we had issues relative to the ability to place staff on short time, to place them on holiday, to be able to make employees redundant or even lay them off. Those are areas that I think a lot of uncertainty arose in. The question of vaccination policies and so on was also something that employers would have struggled with. And then in the context of all of that, we had the questions of discrimination, if you're discriminating against one type of person versus another, and even how do you protect employees' data. All of those were issues which have plagued employers during this time. And basically they have asked for guidance and certainty, but that, in my view, is really the vision that I have for the post-pandemic Barbados, one in which the law is now adapted to take those things into consideration. And it is also adapted to consider the different ways in which we now do business in terms of doing it remotely. having some employees who operate remotely some days and other days not. What are the health and safety implications of that? What about the ease of doing business with the use of additional technology? What governmental support is there in terms of the structures of government, different registries and so on that operate, and the government offices that operate to facilitate transactions? How are we making those adjustments? And how is that being supported by a proper legislative framework? Those are the types of things which I think affect businesses and therefore affect employers and employees. And there needs to be a level, as I said, of certainty in relation to those things. I think even if you have legislation, it can't tell you everything, but there still needs to be some level of consideration for that. And there also needs to be engagement. So we get to that level of certainty, we get to clarity, and we get to employers doing the things the way we would want them to do them by way of engaging with them and engaging with different entities. So for example, you engage with the employers to see how they're affected. You engage with the employees, but primarily through the unions. They're supposed to represent their interests. And I think we also need to engage with some other organizations such as the Bar Association and even BAMP, because those are the types of organizations that have a specialized knowledge that can help us to develop those policies, those procedures, those laws that can take us forward.
Thank you. I'm here looking in the chat and seeing we have 67 participants, and I didn't acknowledge Minister Colin Jordan at a discussion that speaks to the nexus between health and the economy. But Minister, welcome, and I'm sure there are many others. I'm seeing Ms. Reed.
Thank you very much.
As well, yes. So I'm sorry if I did not acknowledge, and all of you, I would say, are important people. I know the Minister feels that way as well. So a special welcome to all of you who have joined in. We are not at the end yet. I'm coming back to the Minister for one comment, but I want to hear from Dr. Ram as we look at building forward, as you have recommended. Is it just mere semantics, or is it a reality as we build forward? You said that we have coined that term in 2017 after the hurricanes, and we sought to build back better. But you're suggesting that we build forward, and you talked about the financial structures, you explained the vulnerabilities that we speak of. And I did hear the Minister talk about some other vulnerabilities that we don't talk a lot about in economics. They came to the fore very pointedly in this season, because just if you look at the set of clusters we had and the challenges we had at the beginning of the year, there were some other vulnerabilities that were spoken about as it relates to the socio-economic challenges in a it is not even post-pandemic, in this pandemic. And we haven't necessarily addressed those. From an economic perspective, we have a scenario where 40% of our labor force lost employment, and in excess of 6 months, and no real way to come and start back. Some of us have been hit, family members, etc. So my comment to you then is, as we build forward, give me some more of those elements that we can look to for the advancement of our people. Our people. And I say people deliberately because people are the ones who will be employed, essentially. Before you give me your closing remarks.
Okay, thanks, Lisa. Well, maybe I'll sort of just wrap it all into one response. Well, just to reiterate again that, if we are going to build forward, it means that our whole mindset has to change, the way how we consider the future. What tends to happen usually in our types of societies is that we have what is called a very high discount rate, in meaning that we discount the future quite heavily. So take, for example, if somebody is telling me that there's a risk that something could happen to me in 5 years' time, well, I'm probably going to ignore that, maybe until a year before it's likely to happen, and then maybe try to do something with it. And then all of a sudden that risk actually hits me 3 years earlier, and then I'm in difficulty. So the reason why I'm saying this is that we have to also take a risk-based approach to our building forward. We have to have persons, and I think this is where the university has to play a critical role, because that's where we are paying individuals to think about all sorts of things, all sorts of eventualities, and to come up with policy proposals that all of the rest of us in society, and certainly those in government, can then learn from and then try to implement correct policies. What are the eventualities that we're looking at? What are the risks that are likely to hit us? And how can we plan for that now, either through policies, building the right types of infrastructure, in ensuring that our education curriculum has been adjusted for that, and then to say, okay, how are we going to pay for all of these things? So it has to be a sort of a real joined up approach to how we consider building forward. I think that for me is a critical component that we have to deal with right now. The reason why I say that, Lisa, is because this pandemic has taught us that we have constantly been ignoring the warning signs. I think Minister Bostic has said this, and Ms. Turton as well. You know, there have been warning signs around, particularly if a virus was to come into into humans, and that gets spread around the world very, very quickly. Since 1989, I can say that we've been speaking about the challenges associated with climate change. How many years later can you really say that as a world, as a global community, have we really done enough to deal with that? Now, the issue that we have there is that that's a slow and onset type of event, and you know, the effects of that are creeping up on us. But that doesn't mean that we need that we should not be dealing with that now. So that is one particular risk we have to deal with. But there are many other risks. I certainly cannot tell you all of those risks because I don't sit down on a daily basis going through all of the risks. But I think we need to ensure that there's a place in society. And I think that the University of the West Indies should play that role, looking through different scenarios and informing us continuously about what we need to do. And then I want to come back to one last point. I think that we have a great opportunity here, certainly in Barbados and certainly in the rest of the Caribbean. And coming back to Ms. Turton's point, I think it was actually bang on that if we are able to identify all of these risks and then we come up with the right policy responses to that, then there are many economic and social opportunities to come out of that, which will benefit us here in Barbados. But you know what? Then we become we understand those risks and how to respond to them, and we can now export our knowledge to the rest of the world and then earning from that. So I think that that's what we have to do. We have to see ourselves as being dynamic, being agile, and I think as well, very much knowledge driven in this period of time, and looking to see the opportunities that we have. Although we live in a bad neighborhood with our vulnerabilities, we can build on there. There are opportunities for us to export our knowledge within these areas. And maybe I'll just say one last thing here, is that we have an opportunity to work together as a Caribbean, because you know there is no one Caribbean island that can really say that it can go it all alone. We need to see the Caribbean as one economic space, because an idea that is developed here in Barbados, we can then try to perfect that in a much larger market of, let's say, 20 million people in the Caribbean, rather than just within 300,000 people. And so I think our policymakers, and you know, we're fortunate we have a great Prime Minister here in Mia Motley who understands that, but we really need to ensure that other leaders across the Caribbean understand that as well, that we are stronger together as well. Thank you.
Excellent. I think that's a really good way on which to end. I thank you so much for the responses. As a panel, all of you have shared some excellent contributions, and we've also had some good feedback as well from our audience. Thank you to the Barbados Employers Confederation for creating this opportunity to discuss a very pressing and important issue. At this time, I'm going to ask Ms. Vice President Douglas to share the closing remarks.
Hi, good afternoon. Yes, you just said it, Lisa. Very, very great discussion, very timely. And so I'd like to share our appreciation for the panel and all of their great insights, especially showing us how we can move forward. I'd like to thank Lieutenant Colonel the Honorable Jeffrey Bostic, Minister of Health and Wellness, and Dr. Justin Ram as well, international economist, and Ms. Kristen Turton, attorney at law. all three of you brought out some great points there, how we can not just move for, build better, but move forward, and how we can be balanced in our view, balancing the economy along with the public health matters. We'd like to also thank the Minister, the Honourable Minister Colin Jordan, Minister of Labour and Social Partnership Relations, and Professor Justin Robinson for joining us out of your busy schedules. We'd like to thank the attendees for participating and the BEC Secretariat for administering and looking after us during this Zoom call. And we wish everybody to have a wonderful afternoon and take to heart all that has been said, and let's not suffer from implementation deficit, but just keep moving forward based on what we're learning. Thank you.